Dexamethasone is a glucocorticoid, a group of hormones that reduces the body's immune response. Dexamethasone is a strong corticosteroid, which reduces inflammation by suppressing the movement of an immune cell known as polymorphonuclear leukocytes, and reducing the permeability of capillaries. Dexamethasone also increases surfactant production and increases serum vitamin A concentration. Dexamethasone also inhibits the action of prostaglandin and inflammatory cytokines, small proteins that influence the interaction and communication between cells. Inhibits the process of equal cell division, granulocyte analysis, and improvement of pulmonary circulation, and works as a substitute for adrenal hormones in people with problems with it. Dexamethasone has recently been shown to be effective in treating the emerging COVID-19 virus. You should get medical advice as soon as possible if one of the following symptoms appears when using dexamethasone: muscle weakness or relaxation, blurring of vision, tunnel vision, eye pain, or seeing halos around the lights, shortness of breath, the appearance of swelling, and a rapid increase in weight, severe depression, change in behavior and thinking, seizures, stool black, or blood in the stool or urine, fast or slow heartbeat, pancreatitis, which results in severe pain in the upper stomach, goes to the back, vomiting and nausea, low level of potassium in the body, which results in leg pain, constipation, arrhythmia, palpitations, increased urination and thirst, or feeling numbness and numbness, high blood pressure, which is accompanied by severe headache, blurred vision, and nose bleeding, extreme hot flashes, mood swings, severe bone pain, frequent infectious diseases. Dexamethasone side effects: fluid retention, increased appetite, mood changes, sleep disturbances, skin rash, bruising, or discoloration of the skin, the emergence of acne, an increase in sweating, an increase in hair growth, headache and dizzy, nausea and vomiting, stomach upset, changes in the menstrual cycle, changes in the shape and locations of fat distribution in the body, high blood sugar, heartburn, excessive allergic reactions such as difficulty breathing, swelling of the lips, tongue, right, face, or urticaria. What are the uses of dexamethasone? Dexamethasone is used to treat conditions associated with infections, immune system disorders, and hormone deficiency. These conditions include the following: infections in general, and is used specifically to reduce swelling, edema associated with spinal and brain tumors, and to treat eye infections. Allergic reactions, rheumatoid diseases, such as rheumatoid arthritis, rheumatoid spondylitis, lupus, and others. Skin diseases, such as pemphigus, Stevens-Johnson syndrome, various types of skin infections, and severe psoriasis. Severe seizures of some intestinal diseases, such as ulcerative colitis. Episodes of sclerosis and myasthenia gravis. Previous treatment for chemotherapy, to reduce inflammation and side effects associated with cancer drugs, such as nausea and vomiting. Adrenal insufficiency, some respiratory problems, such as asthma. Some types of cancer, such as leukemia and fibroids, lymphoma. Improving appetite in cancer patients with severe appetite problems. Diagnosis of Cushing's syndrome. What are the precautions for using dexamethasone? Before starting the use of dexamethasone, you should inform the doctor of the specialist if the patient has or has previously suffered from the following health conditions: liver disease, such as cirrhosis, kidney disease, thyroid disorders, malaria, TB, osteoporosis, as steroids increase the risk of osteoporosis, muscle disorders, such as myasthenia gravis, diabetes, as steroids can increase blood sugar or urine, glaucoma, or cataracts, eye infection with herpes, stomach ulcers, ulcerative colitis, diverticulitis, or inflammatory bowel disease, depression, or other mental illness, congestive heart failure, hypertension, blood clotting disorders. Dexamethasone may mask the symptoms of an infection, or increase the risk of a severe infection, so medical care should be sought in the event of injuries, or note any symptoms of infection, such as prolonged suffering from sore throat, fever, cough, and pain during urination, muscle pain. People who use dexamethasone for long periods are advised to wear medical bracelets. or keep a warning card with them that explains this patient's use of dexamethasone, as the necessary doses may change if the body is subject to unusual pressure, such as severe illnesses, fever, or infectious diseases, or surgery, or medical emergencies. People who use dexamethasone should avoid direct contact with people who have recently received the oral polio vaccine, or the flu vaccine that is inhaled through the nose. Avoid people with chickenpox or measles, and obtain immediate medical care in the event of one of these diseases. You should reduce or stop consuming alcohol while using dexamethasone, especially for people who suffer from stomach ulcers, or who use high doses of aspirin or other arthritis medications, as consuming alcohol increases the risk of bleeding in the stomach and intestine. Using dexamethasone for a long time may slow the growth of children, so the child's growth should be monitored, and follow up with the doctor continuously to make sure the child grows naturally, and take the necessary action in the event of any problems. Dexamethasone should not be stopped suddenly after long-term use, as this may lead to withdrawal symptoms, such as fatigue, fever, and muscle and bone pain. As it should be stopped gradually as directed by the doctor, in addition to the need to not change the dose without doctor consultation. Dexamethasone is considered one of the drugs that fall under Category C, in terms of safety during pregnancy, that is, it can be used with caution in pregnancy if the expected benefit outweighs the potential damage, with no human studies proving its safety. And that dexamethasone is put in the mother's milking, therefore, use during breastfeeding should be avoided. Prefer not to conceive if the husband or wife uses dexamethasone, and it is recommended to use barrier contraceptives, such as male condoms during the period of use. Since children born to mothers who have used dexamethasone during pregnancy for a long time may suffer from low steroid hormones, and they may have symptoms such as nausea, persistent vomiting, severe diarrhea, fatigue, which requires medical attention,